Hey, I'm here to bring you your daily mental health enlightenment, and today we are discussing how you can get connected with mental health treatment. I often hear from people some commonly asked questions about how they can get connected with a mental health professional. So I want to present to you those common questions that I hear today and provide you with some answers and guidance. So the first question, how do I pay for therapy? Most oftentimes you pay for therapy with your insurance, whether you have private insurance or whether you get insurance through the county. Now there are some providers who only take self-pay, meaning that you have to pay them out of pocket and not through insurance, but you don't have to go with those providers. You can go and find a provider who will accept your insurance. The second question that I hear often is, what is a good reason to go to therapy? And as I've been stressing to you since I've been doing these videos, mental health issues are an everyday issue, and they are encompassed in everything that we do. And so anything that you are going through is a good enough reason to go to therapy. If you're going through something that you feel like you need some support with, some additional guidance with trying to figure out how to manage it, something that is causing you prolonged stress, something that you're having a hard time dealing with, anything is worthy of therapy. And I think that everyone throughout their life should go to therapy a few times because there are stressors that we all experience that we just kind of need support and a checkpoint for. Okay, another question I commonly hear is, what is the difference between a psychologist and a psychiatrist? So I myself am a psychologist, meaning that I hold a PhD in psychology, and what I do with people is talk therapy. That's what a psychologist is. A psychiatrist is someone who holds an MD, so they went to med school, and then they have a specialization in psychology so that they can prescribe mental health medication. So psychologist provides talk therapy, psychiatrist prescribes medication. Okay, another question. How long do I have to be in therapy, and who will know? So therapy is a very personal experience, and it is directed and controlled by you, unless you're mandated by court to come to therapy, but we're not really discussing that. So therapy is under your control. You go as long as you want, as short as you want. Now, once you get in with your provider, they will give you an idea of their treatment plan and what they think would be best and most effective for you. And you want to make sure that you don't prematurely end with your therapist, and that you've actually resolved and managed the issues that you actually came in to resolve and manage. But how long you're in therapy is all up to you. Who will know? No one has to know that you are in therapy but you. Your mental health provider is bound by ethics to not share with anyone that you are even coming to therapy. Now, again, unless you're mandated or unless you've been referred by your job, then we do have to check in and let them know that you have been complying and attending your appointments. But most times, any good professional is not going to discuss the meat and details of what you talk about in therapy. They'll just confirm that you actually were there. So again, no one has to know that you're in therapy if you don't want them to be. All right, another question. How do I know what kind of professional I need? Well, it depends on your needs. So again, going to a psychologist, where what you need to do is talk through some issues, figure out how to develop different behaviors, how to cope more effectively with stressors in your life. Those kinds of things would involve you going to a psychologist. Now, if you have an issue where you need medication because there's a neurological issue that needs to be addressed, then you want a psychiatrist. For instance, if you're hearing voices, that's a neurological issue that therapy cannot treat. In therapy, we can help support you with figuring out how you can manage that symptom, but medication is what will help you to reduce and diminish these auditory hallucinations that you may be having in your mind. But it is my theory that even if what you're going through, the symptoms need to be treated with medication, that you couple that with talk therapy so that you can learn more about the diagnosis that you have, learn how to cope with it, how to treat it, gain a sense of comfort with it so that you can function appropriately in society. All right, another question. How do I know if the professional that I've selected is the right one for me? So there are two things I say. One, you want to research the person that you're thinking about going into therapy with. You want to make sure that the issues that you have, that they actually have training and experience treating those issues. For instance, myself, I have a vast range of mental health issues that I can work with and that I treat. But eating disorders is not one that I have a specialization in. Now, I have had training in it, and I did work in an eating disorder clinic while in grad school, but beyond that, professionally, I don't have the training or experience. So for me, an eating disorder client is not one that I would take on. And that's probably one of the very few limits that I have. But you want to research and make sure that whatever issues you're coming in with, your professional has experience and training with that. The second thing is that you want to interview them. You don't want to go in blindly and just accept anyone. You want to get a feel for their style, get a feel for how they interact with you, how they work, how they meet goals, and make sure that it fits for you. Make sure that you respect how they work. Make sure that you feel a sense of comfort and security in the training and knowledge that they bring. Because remember, the goal is for you to really do good, life-changing work every time you go into therapy. And so if you're going to do that, you need to be able to share your deepest and darkest and get naked and raw with the person you're with. And if you don't feel a sense of comfort with them, if you don't respect how they work, if you don't appreciate their style, or if it doesn't fit well with you, then what kind of work are you going to do? So it's important that you interview them to make sure you as the client feels good with them. All right, another question. How do I find a therapist? And I have 3 suggestions for that. The first one is word of mouth. That is great. If you know anyone else who has a therapist and has had a good experience with them, that's a great place to start. Because a lot of times we keep similar people around us in our circle. And so if they found someone that they've connected with, that may be someone good for you to go to. The second thing is that through your insurance, you want to look and see who they cover. So you can go right to the website that's identified on your insurance card, and you can look and search for professionals in your area, professionals who have training in what it is that you're looking to deal with. Or you can call the 1-800 number and you can talk to them and find out what professionals are close to you, who they pay for, who your insurance covers, all that. The third thing is getting a referral from your primary care physician. Far too often people simply rely on their primary care physician to treat their mental health issues. Oh, I'm dealing with some depression. Can you give me some depression meds? And their primary care physician gives them depression meds for 10 years, but they're never actually ever dealing with the real underlying issue that's going on. So your primary care physician can also give you a referral to some good professionals that you can then interview to see if they're a good fit for you. Another question, do I need a referral to go to therapy? And no, you do not. Most oftentimes you can refer yourself to therapy. You can reach out to a mental health professional yourself and seek the therapy that you need. So you don't need a referral. A lot of times I'll run into people and we're talking and I'll ask them, why are you not in therapy? And they'll say, oh, I've been waiting on my doctor to give me a referral. I need to get into my doctor to ask for a referral. You don't have to wait on that. You don't need a referral to go see a therapist. Okay, so those are the frequently asked questions that I get, and I want to add a couple more points just to help you to understand a little more about this seeking therapy process. So one, I want to talk about the different levels of treatment or the levels of professionals. So one, you have an individual practitioner, someone like myself who owns a private practice and so privately sees clients. I bill through insurance. I also see people with self-pay, but I have an individual private practice, so I make my own hours. I accommodate my clients as I see fit. Second level, you have a community mental health agency. And if this is well run and if it is effective and good, they have their finger on the pulse of what's going on in the community that you live in. And so the specific stressors that you may be facing where you live, they should have a good finger on the pulse of that. They should have resources to help you manage those specific stressors. And they have therapists, they have psychiatrists, they even have what we call case workers, who are people who actually actively go out in the community with you to help you to meet your therapy goals that you develop with your therapist. Next level is the larger area hospitals that all have a psychiatric unit where they provide psychologists and psychiatrists. So that's also a resource for you. One of the things that I know in the states that I've worked in that we run into is because they're the larger hospital system, it can be harder to get into professionals there. So the wait list can be longer, and then you can have longer times between your appointments, whereas with me, I see people once every week or once every 2 weeks. In a larger hospital system, it can be that it might get stretched out to once a month, once every 2 months. Now, this is not everywhere, but just some of the experience that I've had. Okay, next level is intensive outpatient programs, and this is for someone who is having very severe issues and they're having a hard time being able to function on a basic level. And so they have 2 or 3 week programs where you go 5 days per week, 8 to 10 hours per day, and you're getting an individual experience where you work one-on-one with someone. You're getting a group experience where you're working with the group. You are getting a psychiatrist to look at your medications. It's short term, but some people really need that to be able to help them get through so that they can then go and be stable and work with an individual practitioner. If someone, say, is suicidal, there are mental health hospitalizations that can happen. And then depending on the severity of what you're dealing with and how safe or unsafe you are to yourself, depends on how long you will be hospitalized. You can admit yourself into the hospital, or if someone has concerns and reasons to think that you are an imminent danger to yourself or someone else, then they can forcibly have you placed in a hospital. That doesn't happen often, but for someone who is actively suicidal, that's something that is a good choice for them to keep them safe in that moment. All right. The last thing that I want to emphasize is that your treatment is a private and confidential process that people do not know about. Sometimes when I get referrals from friends, the people that were referred are concerned that, oh, well, you're friends with so-and-so. They'll never know. I am a professional. I am bound by my ethics, and no one is going to make me lose my license. So you never have to worry about your information getting out or if it's private. So I want to stress that. So if you need therapy, if you need that support, which at some time in our lives, all of us do, reach out. Use the points and tips that I've given you and get the therapy that you need. All right, so what's the message? To think about mental health in a different way, a way that helps you see yourself as a client. And I'll see you tomorrow.